In this session, we will be covering a portion of the patient file. We will go over 4 tabs: page 1, page 2, billing, and custom. We've already gone over how to access the patient file. After having one open, we'll start with page 1. The page 1 tab is mostly basic demographics. The first box is the patient code. You may or may not be able to enter a code based on whether or not you've chosen to auto-number patients. If you have not, the code is also known as the patient chart number. Keep in mind it must be unique. The next item is the responsible party button. It is a lookup option to select a guarantor or parent or guardian. This is the person getting bills on behalf of the patient. You'll often leave it as self. Following that is the demographic information. Last and first name, middle initial, then 2 lines of address. You'll notice that the zip code comes before city and state. This is because as you enter new zip codes, AltaPoint remembers the city and state you have entered as associated with that zip code and will fill in the info for you. Following that are the phone numbers, including a work extension. Next is employer, and just look up to the address file. After that is the provider box, which is the default physician or other care provider for that patient. It's useful in a multi-provider office. Next is the birth date and social security. And then you also have marital status, sex, and race, and then the email address. There are 3 checkboxes you'll see: regular mail, email, and inactive. The mail boxes are just for preference. Inactive is for patients who are no longer needed in the system. Along the bottom there are quite a few buttons. Copay brings up a window in which the receptionist can log a patient copay before the bill exists. You enter the amount, the payment code, and it may be cash, check, credit. That just depends on your billing code. Any notes that you have. Now you have the option to create a new bill or apply to an existing bill. A receptionist who does not do the billing will almost always choose create new bill and then OK. After doing so, a window will come up with the option to print a receipt and letting you know that the invoice has been created. The search button simply brings up the patient list window without having to leave the current patient. The new button allows you to create a new patient. Delete prompts you to delete the current patient. Print brings up a window to print the face sheet for that patient. Photo brings up several options. You can acquire it from a source if you selected it already. You can copy, paste, or delete a photo from the clipboard. You can insert a photo from a file, or you can save a photo that is in AltaPoint to a file. Help is obvious. OK accepts all changes and closes the record, and cancel ignores all changes and closes the record. Next is page 2. First 2 boxes are first and last seen. These will populate automatically as you enter bills. The patient type 1 and patient type 2 are customizable types that you can enter in the file to help categorize patients for reports. Referral type, code, and date are all used for tracking referrals. Deceased date, that's obvious. If you need to fill it in, fill it in. The attorney code is a lookup to the address file again. for keeping track of who a patient's attorney is. Pharmacy code is a lookup to the pharmacy they regularly use or sending prescriptions directly. Primary care type is an option between internal and external, and primary care physician is used if your office is not the primary care. Facility is the location they are seen by default, and the school is a school if attended. The full-time checkbox is there to let you know if they are a full-time student. Also on this page is the contract box. This allows you to keep track of the progress of a payment plan. The last item on this window is the permanent diagnosis section. This is for keeping track of chronic problems that will be diagnosed on every bill for that patient. There's also a button for audit trail, which shows changes done to the patient file and by whom they were done. Moving on to the billing tab. First item on this tab is a checkbox for bill patient. This will bill the patient after all insurance has paid. In almost all cases, leave it checked. You then have a checkbox for the option to email statements. Checking the box will force their statements to email instead of printing. You then have the fee schedule. There must be something in this box, and in a future session we will be covering fee schedules. On the right, the signature on file boxes allow you to check off that you have received a signature for both assignment of benefits and release of information. Boxes to the right are the date on which the signature was received. Below are three tabs: primary, secondary, and tertiary insurance. Each tab is identical with only a couple of differences. First is primary insurance. First is the insurance company, then the insured code. This will differ from the patient code if the responsible party is different than the patient. Then is the insured relationship. Following that is the program name, the ID number, and the group number. After that box is the insurance type. You must enter the type appropriately so that it copies to bills appropriately and claims are sent with appropriate numbers. Next is a box that changes. For primary insurance, it is the contract type. For secondary insurance, it is the type of secondary. And for tertiary, it is non-existent. The only other item that changes is on the right-hand side, the copay per visit box. It only exists on the primary insurance. This is a dollar amount that they pay per visit. Above that, there are boxes for the annual deductible, the deductible paid. This box can calculate based on what you enter on bills, but you can edit it as well if someone paid some deductible elsewhere. And the policy effective date and expire date. There are two check boxes below that. Always bill, which forces the bill always to go to the insurance, and accept assignment. There are two buttons on the bottom. Authorization tracks pre-authorization. And Champus, which is where you enter that info if applicable. The last tab we will address in this section is the Custom tab. This is set up in Practice Information and is simply an area to enter any information your practice needs to track for which we don't already have a way to do so. This concludes this session.